Good afternoon, everyone. Thank you so much for coming today. On behalf of the Global Security and Conflict Management Club and the Global Women in Leadership Club, we want to thank you for coming to listen to women in peacebuilding during the COVID-19 pandemic. Today we have a lovely group of panelists, Mira Kusumarini, who is from Indonesia. She is the founder of the EMPATIKU Foundation, which is a civil society organization focusing on mainstreaming empathy in the security and education sector, addressing violent behavior and extremism. We have Ester Omam from Cameroon. She is the executive director of Reach Out NGO and has been at the forefront of development issues, building a culture of peace and human rights, and conducting humanitarian assistance in the southwest region of Cameroon since 2000. We also have Gimena Sanchez-Garzoli with us today, who is the director of the Andes at the Washington Office of Latin America. Professor McClintock will be moderating today, so I just want to thank everyone for coming, and I hope you enjoy.
Everyone, thank you so much for joining us. And I'll ask Esther, Mira, and Gimena to turn on their videos, and then we're going to ask each panelist to give us just a 5-minute overview of their current work. And then we'll engage in a more in-depth discussion of some of the issues that are facing women peace builders, particularly in this time of COVID, and in the really challenging context in which we currently live and work. So we're going to begin with Mira. So I will mute myself, and Mira, welcome and thank you.
Thank you, Elizabeth. Thank you, everyone. Good afternoon. It is my pleasure to be able to share my experience, our organization experience. We've been working much with different ministries and institutions to address violent extremism in Indonesia. So just to give you a little background, since 2015, 2014, up until now, there are more than 2,000 Indonesians have joined ISIS in Iraq and Syria. And about 600 of them have returned as either deportees or returnees. And currently, unfortunately, 1,200 of them are still in refugee camps, awaiting being returned. And about 80% of them are women and children. We've been working since 2017 with the government, developing rehabilitation and reintegration system in the rehab center in Indonesia, developing the tools, the standard operating procedure, building capacity of the social workers, developing the policy advocacy for the system to take in place. And we have worked closely with the police. With these activities, of course, there's a lot of challenges that as a civil society organization faced, as this is used to be a security approach measures. So there's a lot of challenges, a lot of learning. Based on the findings on the ground, we learned that it is important for community to also be prepared on their return, be prepared on the risk of violent extremism. So we developed an early warning system at the community. We also then developed tools for the community to lead and to prevent, even to preempt cases to go further as a criminal act. And unfortunately, while we've been challenged during the COVID-19, we learned that domestic violent cases have been, increasing, and so we are now working addressing this in coordination with the Ministry of Women Empowerment and Child Protection, how to address domestic violence in an integrated system, working closely with the abusers, which previously the measures focus on the victims. So we are working on this currently. Hopefully that we could have an integrated system and sustainable. So based on this experience, then as activists, peace building makers, we learned that there are many, of course, to take away from our experience, but there are three key points that we learned, that the basic of all of this is the applied empathy. How you apply empathy, how you understand the other side of us, how you understand the different perspectives, and how then you could mediate all those parties in conflicts. And what we learned, and it is very important, not only to respond, but also to build an initiative that is changing the system. So these are the key three takeaways that we have learned, and we would love to have further discussions later on. Thank you.
Great. Thank you so much, Mira. Wonderful to hear about your work, and I'm sure people have many questions about this approach, given the very militarized approach to countering violent extremism. I think your organization's work is super fascinating, so I look forward to learning more.
Thank you.
All right, so I am going to go to Esther, I think, and you have the floor. We look forward to hearing from you.
Thank you very much, Elizabeth. I want to greet everyone who is here present today. I thank the Johns Hopkins University for granting me this opportunity to talk about the work of women in peace building during the COVID-19 pandemic. A world without peace is a world in chaos. A world in chaos is not what we dream or bargain for our children. Women peace builders, despite the challenges presented by a primarily patriarchal system in our country, have always strived for peace in all circumstances, because peace to us is everything. The coming of the COVID-19 pandemic has exposed the fragility of humankind and brought to greater light the deeply rooted inequalities we've refused to address in our country for decades. It has completely altered the dynamics of societal cohesion and grievances from minority and marginalized populations, as these have increased significantly. The role of women peace builders is more important today than ever. The pandemic has intensified conflict dynamics, such as human rights violations, which we witness today more than before, a closing civic space, gender-based violence. And amidst all of this, women peace builders in Cameroon have been at the forefront and are still at the forefront of dealing with this situation. Now, what have we achieved so far? Is when we want to look at what we've achieved so far in terms of women peace builders in Cameroon and with regards to Reach Out, the organization which I am heading, I will say that we've been carrying out actions such as being able to go to grassroots local communities and passing through smaller organizations, especially women and youth groups, providing them with capacity building skills, giving them personal protective equipments and COVID-19 toll-free lines, financial support to patients in order for them to properly quarantine, because we discovered that as a result of economic hardship, most people will not quarantine. They will go out, continue spreading the pandemic. So women and youth receive small grants to carry out economic activities to support themselves and their family during these times. Also, we've been able to sensitize 95,331 people living in conflict-affected communities within the Northwest and Southwest regions of Cameroon. Of this number, we have 48,029 women and 47,302 men who were reached with our awareness creation caravan. We were able to train 726 civil society organizations participants on the COVID-19 prevention and management, 94 frontline humanitarian responders, and 250 community change leaders, who included journalists, teachers, religious leaders, and traditional authorities. Personal preventive equipments were distributed, protective equipments were distributed to health centers, communities, and civil society organizations. And one of our biggest impact was the creation of 600 hand washing stations in 30 conflict-affected communities. Support provided to health centers, communities, and civil society included the personal protective equipment, which were composed of cloth mask, bar soap, water dispensers, infrared thermometers, face shield, and other items for hygiene. And so, after doing that, we ask ourselves the question as to why are we doing all this, giving gloves, surgical masks, and so on. And we say we do all this to help save lives. First, by reducing community spread of COVID-19, and secondly, reducing the stretch of COVID-19 which COVID-19 places on the thin space of peace that remains in our communities. Despite our efforts, we generally have seen an increase in violence in our communities in the COVID-19 era. This pandemic has taught us so many means of adaptations. Our mobile clinics, which have been carrying out life-saving primary healthcare activities in the 2 restive regions with 8 teams of medical doctors and nurses covering 15 districts, have had to make their services more COVID-19 friendly. And it should be noted that we do all this work under difficult conditions. And what we are asking today is that we should be recognized, we should be protected, and we should be supported in the work that we're doing, because it will go a long way in sustaining our activities in the field, and our grassroots communities will live better lives. Thank you, and I'm here for your questions.
Thanks so much, Esther. A lot of challenges faced by women peace builders that Esther has highlighted for us. And given the outreach that your organization does, I can't imagine how challenging it has been in COVID, because the idea is you're not supposed to be doing any outreach and encountering, you're supposed to be keeping socially distanced, et cetera, yet you cannot do that and still do your work. So we look forward to hearing a bit more about that in a moment. Gimena, welcome to you, and we look forward to hearing about your work in Latin America. So the floor is yours.
Hello, everyone, and thank you so much for this opportunity. It's always wonderful to be back at SAIS, even virtually, as a SAIS alum and as a big promoter of SAIS. Had a wonderful experience there, and actually a lot of the activism I do today started due to being at SAIS, and SAIS giving me the opportunity to do events while I was a student there. So I work for the Washington Office on Latin America, which is an independent non-governmental organization that basically promotes and advocates for peace and human rights. And in terms of peace, the country I've worked on for the past 15 plus years has been Colombia. So the way that we work is a bit different than the frontline people working on peace. Basically, we are the advocates and the facilitators for those persons here in the United States. We engage US Congress, US policymakers, we do reports, we do advocacy efforts and campaigns, and we work hand in hand with partners throughout Colombia to bring their voices here to Washington. So you may ask, why Washington? Well, because the United States is the #1 military and economic donor to Colombia, and the #1 ally. It's basically the country that the Colombians listen most to in terms of its government. And so it has a great influential role there. In 2016, after 5 decades of a brutal civil war, a peace agreement was signed between the largest rebel group called the FARC and the Colombian government. That accord basically left over 7 million displaced people, more than 220 persons dead, and tens of thousands have disappeared, and thousands of brutal massacres. So, you know, this was signed, but this is what remained in Colombia. It was an accord that was very difficult to sign because on multiple occasions and in prior peace efforts, they basically, at least 5 of them had attempted to sign an accord, and it completely didn't work and fell apart, making it really hard and making both sides very entrenched. So the first thing that we worked on is getting the United States to support the peace process, which wasn't a given. The United States basically was supporting the efforts of the government to basically do a counterinsurgency, counter-narcotic effort that really looked at exterminating this guerrilla group. So changing that mindset and advocating as to why peace was important and a better way forward was the first hurdle. And then more specifically, working with our partners, we helped the ethnic groups, in particular Afro-Colombians and indigenous. Colombia has 30% indigenous, Afro-Colombian population, over 102 indigenous distinct groupings, to have a voice and to have their voices heard at the peace table, which was taking place in Cuba. This was because both the government and the rebel groups really were negotiating about the territories that the peace would need to be consolidated, and the ones that were hardest hit were Afro and indigenous areas, but the very people and their authorities who would be affected by all of these decisions weren't at the table. So from the part of the government, basically they wanted to pacify these areas so that they could implement large-scale economic projects, many of whom not even consulted with these populations. And on the part of the FARC, they wrongly thought that these people were going to be their political base, which was another major issue, because actually the FARC rebel group has killed a lot of Afro-Colombian indigenous people and leaders and done a lot of damage there. So with that, a global effort was set up through the groupings of Afro-Colombian and indigenous groups, and we advocated for that with the US Congress, Congressional Black Caucus, Obama administration, and they were able to have their say. That say led to something called the ethnic chapter, with transversally basically protects the land and human rights of Afro-Colombian and indigenous people, and basically their collective rights in terms of culture and land. The other area that we ended up having to defend very strongly, which was kind of a surprise to all of us, but it was the reality, were the gender and women's rights provisions of this accord. Those became really controversial, especially after the accord was signed and it went to a plebiscite. There was a large disinformation campaign against this part of the accord. And so we worked very hard on that. Now we are more trying to keep the gains that were made with the peace accord, because the government in power right now is not the biggest fan of the peace accord. And also working with the transitional justice system, which has also been very controversial, but in particular so that it would have a differentiated approach towards gender and ethnic minorities. This is very much something that's never been done anywhere, where you actually have the transitional justice system, both the judicial part as well as the Truth Commission, doing consultations with indigenous and Afro-descendant communities to make sure that what comes out of all this actually works in their favor in terms of reconciliation and truth. The biggest thing we've encountered, which was already a problem as the accord was being signed and not completely unexpected, is that large number of social leaders, and especially those at the forefront of peace, are being killed. Colombia has the highest rate of social leaders killed in the world. And that's very unfortunate, because most of these people who are being killed are the very people who are trying to implement different parts of this accord, whether it be the land reforms, whether it be the victims' rights, whether it be IDP rights, whether it be Afro-Indigenous rights. And so that's a very horrible thing. And sadly, we find that pressure from the outside, especially from the United States, but also elsewhere, has more of an impact on protecting and preventing the deaths of people than pressure within the country, even though, so we work with the civil society that is doing that pressure at the local level and coordinate so that we are also generating pressure from the outside to protect people. So just to give you a sense, since 2016, about 1,000 social leaders have been killed. And then this year alone, we've seen massacres. And just to wrap up, am I supposed to wrap up? Okay, just to wrap up, I would say that we can talk about the COVID in the next round, but we are also helping to support efforts to bring about a humanitarian accord between the Colombian government and the secondary rebel group that's still active, the ELN, because the hope is that that situation can eventually turn into a peace negotiation. So I'll leave it there, and I'm glad to add more about COVID later.
Thanks so much, Gimena. In fact, I was going to go to you with my first question anyway, so you can, I am particularly interested in how, in this role that you have of advocating for the protection of human rights, what is the intersection with COVID in the work that you have been doing? And maybe just 1 to 2 minutes, and then I'll move on. Thank you.
Well, I wish I could tell you that Colombia did a really good job at first, basically putting restrictions in place as soon as possible as they could. And, you know, it really has contained something that's uncontainable very well. The sad part has been that those restrictions, rather than provide more protection for peace builders, it actually has put them in a more vulnerable state. So we've actually seen increased attacks against those peace builders. And we've also seen that more of them have been very much hampered in being able to do their job. So what do I mean by this? So all of the protection mechanisms put in place, which are a combination of national mechanisms that respond when people are under threat. So be it the National Protection Unit, be it bodyguards, be it the justice system, and so forth, basically have all been like, oh, COVID is the priority, and not responding like they used to. The secondary protection mechanisms that comes from the international community present in the country, so the United Nations, the OAS monitoring, what have you, and has not been able to go into areas and do that protection that comes when those situations get difficult. for the leaders themselves, one form of protection is be able to move around a lot, and they can't. The other more problematic situation in parts of the country has been that these areas are very controlled and militarized. And so there's been the illegal armed groups actually taking advantage of that to impose their own COVID restriction and ideas. And actually this has led to these leaders being in a more vulnerable state. So sadly, I can report that the COVID situation has made things more complicated and more difficult.
Thank you, Gimena. I can imagine. It seems to be a two-pronged challenge. One is the almost weaponization of COVID in those places where armed groups might, as you say, want to take advantage of that to pursue their own goals, and then further marginalization of those communities that are already struggling, which leads me to Esther. I'm just curious, you talked a lot about the burden on women in particular and women peace builders. And I'm curious if you can tell us a bit more about how in your communities you're handling, you and your colleagues are handling these multiple challenges that seem very specific to women because of their roles just in their families, in their communities, now as peace builders, and let's add on to that multiple responsibilities as the responders in times of COVID. So could you tell us a little bit more about how you are handling those multiple burdens?
Oh yes, Elizabeth, it's not been easy, moving from one crisis to the other and seeing the pains and sufferings that our women and children go through. We try to come up with a community of practice whereby women work for other women, women support women, and carry out psychosocial support. We do counseling on wheels, whereby we move from community to community, try to ask what are the difficulties with the challenges with that women face. And from there, we try to give some counseling. We try to conduct some counseling sessions. And we've also devised other means. As I said, COVID-19 has taught us many means of strategies of adaptation. We try to organize self-care. We try to organize self-care sessions whereby the women go out to release this tension, which they face every day by storytelling, singing, dancing, swimming, playing, and so on. These, just to name these few, these are some of the few activities which we've been able to carry out. Like just yesterday, we organized a community conversation where women came together and were bringing out their burdens, pouring out the issues plaguing them within the communities, and trying to find common grounds, shared values, and they even were carrying out activities such as trying to find out what divides us in times of crisis. What are the dividers and what are the connectors? And how can we transform the dividers into connectors so that we do not fall prey of what is going on already with the parties in conflict? Thank you.
Fascinating, Esther, because for those who hopefully have studied their conflict management, they know the connectors and dividers approach, which all peace builders want to be attentive to. And it sounds like you and your colleagues in Cameroon are really trying to use your past experience as conflict resolvers in this time of COVID and not let COVID not be weaponized, if you will, or used against peace, but rather can it be a vehicle for bringing people together to discuss? And yes, very critical issue.
In my organization, we are calling that bridges of peace. We term it bridges of peace, trying to.
Great, thank you, Esther. So Mira, this brings me to you, and you mentioned just at the end a really important lesson that you learned from your work about the applied empathy. And I'm sure many of those attending would love to hear a little bit more about what you mean by that, because I think as we briefly mentioned after your presentation, approaches to countering violent extremism tend to be quite over-militarized, and you seem to have a completely different approach. And I'm sure our participants would love to learn more about what does applied empathy actually mean? How does it manifest itself?
Yes, thank you. What we learned in applying empathy in our approach is to have people to have the feeling, have the thoughts on the other side. So many times people try to focus on the victims, focus on massive majority, but to bring about change, we need to engage the abuser. We need to engage the perpetrators. So this is how we bring people, the government, social workers, the community leaders, everyone, to put themselves, how if they are in the shoes of others, or the shoes of the abuser or perpetrators. So we bring everyone's interests to the table, and how we address this together. So it's not easy, of course. It takes time, it takes courage, it takes how to manage all the risks, being targeted by the radical groups or being recruited even. But that's all the risks that we need to manage. We need to mitigate. So I think the basis of all approach is the understanding of the others, and how you, empathy is not just a concept. It should be applied in concrete actions. Thank you.
So I wanted to ask Mira, though, one important piece of this resistance, I would imagine, from those who think, why should I take the perspective of the perpetrator? How do you handle that resistance? How do you work with people to help them understand the long-term benefits of such an approach? Because I assume that's directly related to the sustainability of a peaceful coexistence going forward. How do you manage resistance?
Actually, the key is to the knowledge, the absence of knowledge of the risks of violent extremism. So we do a lot of campaign, a lot of socialization, discussions on the ground about the risk of violent extremism, and understanding those individuals or group of individuals who are already exposed by this ideology is important. So then they wouldn't be recruited, they won't be embraced this ideology. So it is important for everyone to really understand the risk, and engaging these perpetrators would prevent for further spread of the ideology. So working together with the perpetrators is important. We learned that working with them is not they as survivors, but now as you know, we've been together for some time now, they have become advocates of this challenge.
Great, thank you. So a question for all of you, and anyone and all of you can answer it if you choose. I'm curious how, in this time of COVID, it's clearly impacted your work in different ways because of your different roles in your respective organizations and how you work with your communities and the peace builders. But I'm curious how, if any, what kind of impact technology has had, and if it has helped or hindered your efforts, particularly work you might do normally with more marginalized communities.
I will pick it from here. And I will say that originally, we used to live our normal lives, no social distancing. We never had the culture of Zoom meetings or working remotely. But with the advent of COVID-19, we learned to adapt. And today, social distancing has become a way of life. In our families, in our organizations, and within the communities where we go, we no longer hug as used to be, you know, and the Zoom, the online meetings have made us to get closer to the world, you know, in one way or the other. It has given us so many opportunities, so many openings, but also it has brought us some burdens or sufferings because we live in regions where access to internet or internet connections still remain a nightmare. So carrying out having those Zoom meetings are a problem. Like just this event for today, I had to change like 3 modems, you know, and look for someone who will help me share his connection with me in order for me to attend this event. This is just one of them. We had to downsize the number of our staff within our organization. And today, we no longer smile. We smile with in the masks. We put on the face masks, and then usually when we ask the communities, when we are talking to communities, when we are training the communities, we ask them to smile, and everybody said, "But how can we smile within the mask?" So that's one. That's one other key change in our life. You know, there are so many, but let me just end to this few. And also, this COVID-19, which has added to the ongoing conflict which we've been living, has reduced the amount of funding. You know, the number of partners we used to have has tremendously been reduced as a result of economic hardship, which we all know is going on all over the world.
Thank you, Esther. Thank you. Gimena or Mira, do you want to, Gimena, please.
Sure. So, you know, the technology thing has been obviously most of the areas that we are talking about worst affected and where these leaders are and with whom we work with the closest don't have access. So that's been very difficult in many, many ways. But then on the upside, when the access is done, even if it involves like a tremendous effort and multiple things and reshifting and what have you and flying people places closer, we've had situations where like you could have an exchange with people from 30 different communities at once, which is probably more than we would be able to do in person. So it's had both ways. I think for established relationships that are very longly worked together, it's been great. So even with the Congress, we are able to do it and what have you. But with newer relationships, it's not the same. It's very difficult to develop. In terms of what Esther just mentioned, I mean, the attention has been a big problem, and so has the funding issue. I think that's we're starting to see the effects of that, but I think that's going to get a lot worse for a lot of our partners in the coming year.
Absolutely. So the knock-on effects of an economy that's not functioning as we would hope. So not only COVID itself, the risk of contracting the virus, but the economic impacts are going to be far-reaching. Absolutely. Mira, do you want to add anything to that? How technology might have impacted your work?
Yes. It gives both sides actually, but first and foremost risk in being now everyone on more online than offline is the risk of people, especially those who are vulnerable, to be exposed to the propaganda of violent extremism. And they use the online media as the major strategy, spreading the message. And people who are vulnerable in terms of economy, in terms of finding identity, wanting to be more religious, then they easily embrace those ideology. So being online is made people more vulnerable than before. And we learned that more messages have been spread. Some are hoax, some so it puts people more vulnerable to be exposed to the ideology. But we also have difficulties, of course, in having one-on-one, offline connection, and it's difficult to handle closely with the people. But as mentioned earlier by Esther and Gimena, that this would give us actually an easy outreach to different areas at once. So we need to work around the challenges, but we need to seize the opportunity of being online. So I think those are our experience.
Right. So we do have a couple questions from the audience, and I want to remind the participants to please feel free to submit your questions in the Q&A. And so what I'm going to do is I want to ask our panelists just to reflect for a moment, and I will come back to this question. But I know many of our participants are really curious about what it means to be a woman peace builder. So just keep that question in the back of your mind, and I hope we'll get to it before we end. But there are a couple of really interesting questions already from participants, so I'd like to begin to field those. So Mira, one for you is that one of our participants would love to hear an example of applied empathy. Can you give us just a specific example with either a person or a community with whom you've worked?
Yes. Well, we help the children, for example, in the rehab center. We have sessions. They used to be in their own community with their own mindset and all the ideology indoctrinated by the parents. So during the sessions, we try to engage other children of the non-community member, and to learn that these children live with the other children of a different background, different religion, different education base. Some are religious, some non. So this is an example of how we instill empathy in the children and exercise through different sessions. We also, another example, we have support women with providing training, cooking training, but the training actually focus only for the deportees, the clients. But the approach that we applied is to bring other women to the training. With that session, we bring different people, and that the community people could mingle with the deportees, and through that we focus. The message is we work together. So those are just little examples how we instill empathy in our programming. Thank you.
Great, thanks, Mira. Gimena, this question is for you. You mentioned that the current president of Colombia has spoken out against the peace agreement. And moreover, a referendum on the deal was notably rejected in 2016. So to what extent is skepticism by the population with regards to the peace agreement and its integration? Sorry, the question now has disappeared.
Yeah, I think it was something like, to what extent does that skepticism have to do with the rejecting of the peace accord, or something of that nature? Sorry if it's not exact.
Yeah. No, that's okay.
Yeah.
Thank you.
So first of all, it's important to mention that it was basically the plebiscite was won by a very slim margin, and it was a very controversial plebiscite because of a lot of false information. Amongst the false information, one area that was targeted was the gender accord, whereby information that's not true, like saying that this would legalize abortion, the accord had nothing to do with abortion, such as saying that this is an imposition from the outside of a gender ideology, which is also not true, since it was built and put together by the subcommission, by women's groups of all sorts in Colombia, and that it would promote homosexuality, also not true. So I think that it's questionable, really, that result to begin with. But really, Colombia is two Colombias. You know, my 20 years working on Colombia, I've seen that there is very much a middle and upper class privileged Colombia that has mostly in the last decade lived kind of in a bubble away from the conflict. And its impressions of the conflict are based upon news reports and other things. And then there is the rest of Colombia, which is the Colombia I visit all the time, 5 to 10 times a year in normal times. And that is the Colombia affected by the conflict every day, with these illegal groups, including the FARC, basically at their doorstep imposing things on them and abusing them. That rural poor Colombia very much voted in favor of the peace accord because they thought that having the FARC demobilized was better than having them active and continuing their abuses. So yeah, the FARC in general by both is, I would say, both Colombias is very disliked. This showed in the polls in the first elections that they ran candidates. They weren't even able to get presidential candidates off the ground. And more than that, you know, the seats that they have now are really due to the peace accord. I don't know if they would have won those seats if they had been open. So it's very expected to have that rejection and stigmatization of the FARC given the tremendous abuses they've committed. But the one unique thing about this accord has been that it integrates the perspective of 6 commissions that went to Havana where the negotiations took place, of victims of all of the different actors in the conflict, including many FARC victims, of putting what they think is the priority of what they wanted to see in a transitional justice system, because transitional justice system is set up when a justice system cannot in any way address all of the cases that have taken place at that time. And its purpose is to find reconciliations and moving forward. So in that case, those were the victims, and the victims have said very strongly, and also having accompanied the Bohaya massacre victims, those are the ones where over 80 Afro-Colombians were basically incinerated in a church after the FARC threw a pipe bomb at them, that what they want more than anything is the truth. They want the truth, they want to know what happened, they want to know everything else, and they're willing to sacrifice how much punishment time, how much jail time these perpetrators are given in order to understand that, so that they can heal, they can know where the bodies are, they can, basically heal from the conflict and move on and not have that torture their lives every day. And so I think, like, to answer the question, most of the persons who are opposed to the peace or who voted for the current president, he really represents the interests of those upper and very wealthy Colombians that are not as interested in peace for a whole host of other reasons, including the fact that they may be questioned about their role in the conflict.
And I think for those who are not aware, the peace agreement in India is a really interesting example of, as Gimena mentioned, of trying to get more voices into the actual peace process, even in spite of these challenges you mentioned earlier about respecting the gender provisions of the agreement, which it's very important to have an organization like yours to advocate for those provisions, because there are so many different sets of interests. So do we get a lowest common denominator deal, or do we really work hard to make sure that the needs of all Colombians are met within the context of whatever agreement was essentially reached and now implemented? So and I'm going to go to Esther in 1 second. Gimena, the last part of the question was, so how has the reintegration of the FARC been working? Is it being implemented?
Well, frankly, as a Colombia observer, I think it's worked a lot better than I expected it to. From the perspective probably of the demobilized, and I visited some of these demobilized areas, it's not working perfectly. The biggest issue has been that there have been multiple demobilized persons killed. But frankly, given the history of Colombia and how violent other post-peace agreements have been, I actually think it's been lower. So I'm not advocating for killing people, but I'm just saying that, if you look at it broadly from the outside, it's been rather successful. Yes, to be able to reintegrate people is incredibly complex. I think that Colombia has probably one of the most sophisticated systems in the world, at least on paper, but it really focused more for individual and not so much the collective, and less so in a lot of these rural areas. So yes, there's a lot more that can be done, but I'm not sure that all of that should be done by the government, is the first thing. I think it needs to involve many others. Now, the stigma applied to this has been a problem for all armed groups that demobilize in Colombia. The rejection of having been part of that conflict for what you did, for what you represent. And I think that's probably one of the hardest parts to overcome, and especially for women. It's important to just mention that a good number of women are in the FARC. It was maybe 30 to 40% of those who demobilized. And for them, they have the double rejection, I would say, of not only having been in the FARC, but also being a woman who did this, or who was as a part of this in a society that fundamentally still, has a very sort of machista look at gender roles.
Right. And I suspect that Esther and Mira have experienced similar, in particular, with the stigma of someone who had been participating in an armed group and then now trying to reintegrate, particularly in the Anglophone, Francophone conflict in Cameroon. So it's a challenging situation to manage that reintegration process and rebuild lives. Esther, this next question, I think you began to address it, but I think that participants would love to hear a bit more. It says, have you seen, I know that you're struggling with donors and funding, but have you seen any changes in attitudes from them with regards to recognizing the extra burden placed on you by COVID-19? And do you have any strategies that you implemented that seem to have worked, Esther?
Okay. Yes, Elizabeth. I will say that Reach Out Cameroon was the first responded to COVID-19 response in our region. And immediately we understood that it was not something to toil or play with. We drew the attention of the partners we were working with at that time in early March, especially the World Food Program, UNICEF, WHO, Care Cameroon, and the rest. We told them that it's high time and there is need for us to mainstream COVID-19 response in all our activities. And I think they didn't hesitate to give us the support. Some other partners were very difficult to convince, but others immediately, gave in and made funding flexible to us. They allowed us, to remove some budget from some budgetary lines in order to serve the population with COVID-19 preventive and management strategies. And when you talk about strategies, what we did and we continue doing is lobbying and advocating. When we have issues like the crisis, the pandemic, and other issues, we immediately start lobbying the partners. We advocate, we try to make them understand that there is need for this to be included into the plans which they are making. There is need to rethink positions in order to save lives.
Nice. And I think that is an ongoing struggle for NGOs, CSOs to constantly negotiate with donors to ensure that funding is more flexible because dynamics change on the ground. And that has been an ongoing struggle. I think all of you can appreciate that.
But it's not easy, and it has not been easy.
No,
you must prove credibility for partners, to give you that trust for you to go on with the mainstreaming or reallocation of budgetary lines.
So just as we come to a close, I'm wondering if you each want to say something about what it means to be a woman in the field of peace building, and if you have one piece of advice for our participants. Mira, do you want to be?
Yeah, sure. Well, of course, it is not easy at all, full of risks. I was once interrogated by the police being suspected in support of these radical groups. And that is one thing faced by CSOs in this field. The field that used to be masculine, security focused. Now we bring human connection, basic needs of those who've been, who've engaged before with the radical group. So it is not that easy. A lot of risks, not only exposed by these radical groups, but also by the law enforcers. Second thing is that we've been working in, as I mentioned earlier, in security and masculine focused field, and having a woman advocating for the past perpetrators is something that is not yet on the mind of most of the people. You know, the government is still struggling, even though we already have a legal basis for this, but they don't have the knowledge, they don't have the skills, they don't have even the system to apply rehabilitation and reintegration for these perpetrators. So it is not easy, right. But I'm also a victim of politics. So there's a lot of challenges, but one thing that I've learned is we cannot just give up by right. those challenges. And and that's the spirit we need to bring along with our work.
Wonderful. Gimena, do you want to offer your closing thoughts?
Sure. Just very quickly, I would say again, it is difficult and it's full of risks, including for myself. I've had assassination attempts, death threats, even though I'm not on the ground, so you can imagine what it's like on the ground. I just would say the advice is to speak confidently and don't allow male voices to interrupt or speak over you. You know, just do it. Doesn't matter. Or, you know, if you have to interrupt to get heard, then interrupt back. But women have a special ability to be able to really bridge some of the most complex issues and complicated issues. That's really what I saw, you know, in terms of this whole process with Colombia. And I think that's really important. And just to say that, you know, while it's hard, the rewards are really great. When you see that achievement, when you see a peace accord get signed, when you see the significant difference that makes in people's lives, I mean, it's worth all the bad part, is what I would say.
Thank you. Esther?
Yes, I will say that being a woman peace builder is not a bed of roses. It is not a bed of roses and will not be a bed of roses. Twice, I have been held at gunpoint. My children and staff have been kidnapped on several occasions. Our humanitarian vehicles burned simply because people will not believe that women can also deliver. And when they see us delivering and delivering in a way that makes people to dove their hearts, you know, they start framing us up and they start instrumentalizing our sisters, women, to come and do same to us. But what keeps us moving are the little smiles and the hope that we read in the eyes of the communities which we serve, because those communities know us and we know them. They trust us and we believe in our communities. So I will just say that we have to keep moving, we have to keep pushing. It's not an easy road, but it is worth the journey. That is all I would say for tonight. And because it is worth the journey, I was recently nominated, given an award of the Cameroon Shiro, COVID Shiro, and the Pioneer Woman Peace Builder Award for my country. So I think it is worth doing, no matter the pains.
Congratulations. Wow. Yeah. Wonderful to hear. We celebrate you. Abby, Corinne, do you want to close?
Hello all. Thank you so much to our panelists for sharing your stories and experiences with us. I know we just scratched the surface, so we really thank you for taking the time to talk about your important work and what you're doing. And thank you, of course, to our moderator, Professor McClintock, for facilitating such a rich discussion. And of course, thank you to all of our attendees for joining us today. And with that, we will close. Hope you all have a wonderful day.
Yes, thank you.
Thank you.
Wonderful day, everybody.
Thank you.